Hi, this is Dr. Sherry Shabowski from Medical Education in Minutes, here with another classic clinical presentation. Today, we're going to meet Amanda Fugari, MD. Amanda is a 65-year-old physician with diabetes, high blood pressure, and high cholesterol who woke up for work, and while she was in the shower, she noticed a sudden loss of vision in her right eye. There was no pain. She was not having any problems previously. It seemed like a shade came down over her vision, and then it was just gone. She started to gently massage her eye. She woke her husband and told him she needed to go to the hospital. Before she left, she grabbed a paper bag and took an aspirin. On the way to the hospital, she was breathing into the paper bag. When she arrived in the hospital, she told the medical student what had happened. By the time she got there, her vision had returned. Amanda realized that the student did not know how serious her symptoms could be. He had said, "Your vision is fine and your eye exam is normal." And she said, "Let me explain why I am still concerned. Remember the branches of the common carotid artery? It branches into the external carotid artery and the internal carotid artery. The external carotid artery supplies her face, scalp, and external eye. The internal carotid goes into the skull. It sends a branch to the eye called the ophthalmic artery and then joins the circle of Willis. People with metabolic syndrome are at higher risk of atherosclerosis. And as you know from my past medical history, I have many risk factors for atherosclerosis, not the least of which is my age. It is not uncommon to have atherosclerotic plaques in the carotid artery. This is the origin of many strokes. What I am concerned I have is something called Amaurosis Fugax. When a small piece of the atherosclerotic plaque in the carotid artery breaks off and embolizes, it can go right into the ophthalmic artery, causing a painless loss of vision in one eye, like a shade is being pulled over the eye. It is most obvious when you cover each eye sequentially. It is then that you realize the visual loss because there is no pain and no other symptoms to give you a clue and the other eye is absolutely fine. This is exactly what happened to me. If you have one embolism, you can have more. So I came in to prevent a more serious stroke. On the way in, I was breathing in a paper bag to simulate hypoventilation. Given this information, the student does a complete physical exam, including a neural exam, all of which were normal. He says, "We will do the appropriate tests for your TIA symptoms, that's transient ischemic attack, that you've already identified. But can you tell me why you thought it was a good idea to hypoventilate yourself?" Well, from the Henderson-Hasselbalch equation, if you increase CO2, that will push this equation to the right, causing an increase in hydrogen ions. That will lower the pH and again increase circulating hydrogen ions. Those hydrogen ions will go into the CSF and stimulate vasodilating metabolites. Protons like hydrogen activate the voltage gated potassium channels, causing hyperpolarization of the endothelial cells. This reduces calcium influx. This decrease in calcium concentration leads to muscle relaxation and therefore vasodilation. The idea is I want to vasodilate the ophthalmic artery so that that little piece that's obstructing can move downstream. I considered the risk benefit of this choice and thought it was worth it to give hypoventilation a try. Amanda's workup was significant for chronic microvascular disease in her brain on CT, and there was, in fact, atherosclerosis in her right coronary artery. Thank you for redirecting me. You were right. We will give you some aspirin and admit you. I already took aspirin, but thank you for taking care of me, doctor. Thank you so much for being here for another classic clinical presentation. I hope you enjoyed it, and I'm glad to see you next time.